Acute appendicitis is an acute inflammation that starts rapidly and becomes severe in a short period of time. Inflammation is part of the body's immune response. Infections, wounds, and tissue damage would not be able to heal without an inflammatory response. It is the body's attempt to protect itself to remove harmful organisms. Inflammation symptoms vary but may include pain, redness, immobility, edema, and heat. When inflammation occurs, chemicals from the body's white blood cells are released into the blood or tissue to protect the body from foreign substances. Blood flow to the area is then increased.
Pathophysiology. The appendix is located in the lower right quadrant. It is a small, finger-shaped pouch that extends from the inferior part of the cecum. Appendicitis is inflammation of the appendix. Blood supply is impaired, which may result in gangrene and abdominal pain. The role of the appendix is not entirely clear. It is thought to have some immune function. Appendicitis is the most common reason for abdominal surgery. True or false? The appendix is found on the lower left side of the abdomen and is connected to the cecum of the large intestine. The answer is false. The appendix is located in the lower right quadrant and is connected to the cecum of the large intestine. Etiology. Appendicitis occurs from an obstruction of the appendiceal lumen. This typically is due to lymphoid hyperplasia, an increased number of normal cells in the lymph nodes, or by fecalith, accumulated feces. Lymphoid hyperplasia is often caused by infection with bacteria, viruses, or other germs. This obstruction causes inflammation, leading to distension and a cascade of effects, including ischemia and gangrene. Appendicitis is most common in individuals between ages 10 and 30. Current research shows that 7% of people will develop appendicitis in their lifetime. There has been no evidence of specific diets that increase or decrease the likelihood of developing appendicitis. Everyone's favorite, select all that apply. Select all the following that are not causes of appendicitis: fecalith, routine usage of NSAIDs, infection due to H. pylori, lymph node enlargement due to viral or bacterial infection, and diet low in fiber. The answers are B, C, and E. These options are not causes of appendicitis. Routine usage of NSAIDs and infection due to H. pylori are causes of peptic ulcers. A diet low in fiber is thought to be a cause of diverticulosis. Fecalith and lymph node enlargement due to viral or bacterial infection can cause appendicitis.
Clinical manifestations. Before I begin talking about clinical manifestations, it's important for me to mention that every individual is different and the patient might not always exhibit these exact symptoms in this exact order. Some of the subjective clinical manifestations include pain in the periumbilical area, which is around the belly button, if you will. The pain is later followed by loss of appetite, reports of nausea, pain that moves to the right lower quadrant and localizes at McBurney's point, complaints of localized and rebound tenderness. The patient might also report that sneezing, coughing, and deep breathing worsens the discomfort. Some of the objective clinical manifestations include vomiting, muscle guarding or stiffness. The patient might flex the right lower extremity and appears to be more comfortable when they're lying still. The patient might also have a low-grade fever. Diagnostic studies. Diagnosing appendicitis begins with taking a history and physical. Blood work will be ordered to check for elevated white blood cell count, which is indicative of infection. A urine sample will also be collected to avoid confusion and rule out a urinary tract infection since they have similar symptoms. A CT scan or an ultrasound might be ordered, although a CT scan is preferred. Early diagnosis of appendicitis is extremely important because if left untreated, it can lead to life-threatening complications that will be discussed later on.
Some nursing diagnoses that are associated with appendicitis are imbalanced nutrition related to nausea and vomiting, fluid and electrolyte imbalance related to vomiting, acute pain related to abdominal discomfort, anxiety related to changes in health, risk for infection related to surgical incision, activity intolerance related to pain, constipation related to limited mobility and pain medications post-surgery. These diagnoses are all very important, but the most important ones are the risk for infection because we don't want a patient to come in with one problem and develop another one. Acute pain because it is our job as healthcare workers to do the best we can in monitoring a patient's pain and making them comfortable. And of course, fluid and electrolyte imbalance because these can pose for worse complications for the patient's health and can cause complications for surgery or even for recovery. The care of a patient with appendicitis takes all the healthcare workers. An antibiotic is required if the patient's appendix has ruptured. Typically, the antibiotic prescribed is penicillin or ciprofloxacin. Antibiotic treatment helps stop the development of an infection or begins to kill an infection that has developed in response to the ruptured appendix. Antiemetics are then prescribed because patients will typically present with nausea and vomiting. An antiemetic will help to relieve this discomfort and stop any more loss of fluid and electrolytes. Analgesics are used post-surgery to help alleviate the pain at the surgical site. Morphine can be helpful in relieving this pain. Antipyretics are used because a lot of patients will commonly present with a fever related to the appendicitis. Surgery is the most effective treatment of appendicitis, thus the patient would need to be placed on NPO status before this, and that would then require oral hygiene since the patient's mouth will get dry when they're NPO. It is not always likely that the patient can be NPO before surgery because if a patient presents with a ruptured appendix, they would require immediate surgery. IV fluids would be needed to maintain the patient's perfusion and ensure they do not become dehydrated. Post-surgery care would require monitoring vital signs, managing the patient's pain, and promoting ambulation as soon as the patient can to prevent any complications after the surgery, such as atelectasis or even constipation because of this immobility.
Peritonitis. If your appendix bursts, it releases bacteria into other parts of the body. Peritonitis can occur if the infection spreads to the peritoneum, the thin layer of tissue that lines the inside of the abdomen. If the appendix bursts, an abscess can form. This is a painful collection of pus that occurs as a result of the body's attempt to fight the infection. This situation can lead to the inflammation of the membranes lining the abdominal wall and the organs. This condition can become life-threatening if not treated in time. Sepsis is the body's overwhelming and life-threatening response to infection that can lead to tissue damage, organ failure, and death. The chemicals released into the blood are used to fight infection, and they trigger the widespread inflammation. This leads to blood clots and leaky blood vessels. They cause poor blood flow, which deprives your body's organs of nutrients and oxygen. Blood pressure drops, leading to septic shock. Gangrene is a condition that occurs when body tissue dies. It is caused by a lack of blood supply to the tissue. Gangrene can occur to body organs like the appendix. Surgical removal of all dead tissue is the mainstay of treatment for gangrene. A client with acute appendicitis develops a fever, tachycardia, and hypotension. Based on these assessment findings, the nurse should further assess the client for which of the following complications: 1. Deficient fluid volume; 2. Intestinal obstruction; 3. Bowel ischemia; or 4. Peritonitis. The correct answer is D. Peritonitis.